Hello everybody, my name is Sahil and today I'm doing a presentation on topic the impact of social isolation and economic strain on youth stress, building resilience together. So this presentation will cover all the topics, what youth faces stress because of economic strain and social isolation these days and how we can help them and some expert advices that can help us. So what are social determinants of health? Social determinants of health are the conditions in which people live, work, and grow, shaped by societal forces. Factors like low income and social networks significantly influence health outcomes by affecting access to resources, emotional support, and stress resilience. So, youth mental health challenges include stress, are rising due to economic strain and social isolation. Research shows that low income limits access to stress relief resources, while weak social networks exacerbate isolation and anxiety. Addressing these determinants through community and policy efforts can improve youth resilience. And in the upcoming slide, we are talking about why youth health matters today. So, a bit statistics. Over about 70% of youth report family financial struggles as a major stressor these days. And financial difficulties can affect emotional well-being, educational outcomes, and social connections, contributing to a cycle of stress and isolation. Example is Maria, a 16-year-old high school student, lives in a household where her parents work long hours in low-paying jobs to make ends meet. The financial strain means that Maria can't afford extracurricular activities, school trips, or even reliable internet access for her studies. This has caused her to withdraw socially as she feels embarrassed to admit her family's situation to peers who enjoy these privileges. Ria also takes on household responsibilities like taking care of her younger siblings, leaving little time for her to focus on academics or personal development. As a result, Maria experiences chronic stress and feelings of isolation, affecting her mental health and academic performance. So Maria is an example of a girl because of their economic hardship, she is facing problems in which she cannot focus on her studies and excel in her education. So, mental health plays a vital role in everybody's life, and it affects youngsters very much. So, how do income disparities and social isolation contribute to youth stress? Income disparities are like differences in incomes of different families. So income disparities and social isolation contribute to youth stress by limiting access to healthcare, education, and extracurricular activities, which are vital for mental well-being. Social isolation intensifies feelings of loneliness, reducing opportunities for peer support and community engagement. So having less money deprives some people of taking proper healthcare, education. They cannot go to school trips. They cannot go to science fairs like extracurricular activities, which are very vital for a well-being to experience. And social isolation intensifies feeling of loneliness. This means uh, a youngster feels loneliness if he stays alone, which reduces the opportunities of peer support. Peer support, as in you can say like engaging with your classmates, your friends, and community. So the our purpose of the assignment, this presentation is a proper analysis on aims to understand the root causes and the impacts, as well as potential interventions that can help youth to excel and overcome the situation of stress. And we will also be talking about programs and community aid initiatives that can potentially help them. So, as in order to help the youths, we need to understand the problem first. We need to get to the root cause. So, firstly, is the economic strain and depressive symptoms. Adolescents' perceptions of family economic strain significantly predict depressive symptoms. For instance, youth who are more aware of their family's financial difficulties tend to experience higher level of emotional distress, which impacts their academic achievement and attitude towards school. So this means that youth who are like who know a lot about their family's financial situations make them more stressed because they know they don't have a lot of money, they cannot afford some things, and which makes them stressed. And other thing is social isolation and depression. Adolescents exposed to community-related stressors often experience heightened symptoms of anxiety and depression, which can lead to social withdrawal and a sense of isolation from peers. Social support is often diminished in such cases, worsening emotional challenges. There are some community-related stressors that heighten the anxiety and depression of youngsters, which can lead from staying away from their peers and not talking to their friends, which can break the emotional bond between them. Moreover, development sensitivity to economic strain. Findings reveal that the association between perceived economic strain and depressive symptoms is stronger during later adolescence compared to early adolescence, showing that age is a critical factor in psychological impact of financial stress. This theory says that youth is not depressed in the earlier stage of adolescence as it is in the later stage of adolescence, which which proves the point that age is a critical factor in financial stress. Other than that, consequences of emotional struggles. Adolescents with symptoms of depression linked to low parental monitoring or stressful environments are more likely to experience social isolation. This further limits their ability to engage in healthier peer relationships, reinforcing loneliness and emotional detachment. So adolescents with symptoms of depression are morely because parents take less care of them and like engaged in more personal things like earning money, taking care of the family, but they like forget to totally talk to their child and ask about their life and tell about your life. So they feel like a bit isolation because of what they can, because of that, they stay away from their friends and don't engage in like healthy relationships, which increase further loneliness and emotional detachment. Let's see what our expert Fernando has to say about this. Moving forward.
So now I'm with my expert Fernando, and I'm going to ask his input about stress in youth and their social isolation and economic strain. So, hi Fernando, what are your opinions about uh, youth stressing these days because of determinants like social isolation and economic strain in their life?
Yeah, so we have to take it back into a more social perspective, and we have to notice that from the 60s or 70s, especially from the 70s, there's been a social shift from a more global priorities to a more independent uh, priorities, where we've put more emphasis on self improvement or self success and social status over more approaches as making sure for claiming for world peace and taking care of the environment. So nowadays the youth is more concerned with that success, with that empowerment in general, and that empowerment may take way too much of their energy as a result of putting way too much emphasis on that. The frustrations of not getting it may cause mental distress, and at the same time they may have this self or this idea that it is necessary to have money to be able to be happy. So the association of money with happiness, which it is a crucial factor, it's definitely a crucial factor, um, but at the same time, it is not the main indicator of happiness. And nowadays, youth associating money with happiness is probably the main factor. So as a result, and at the same time result of the technology, which has also have an impact on it, especially from the 80s, we had the millennials, and we saw the impact of the millennials, the technology on them may have caused them to become more independent, but the cost of that independence is the depression at the same time and less collaboration. Yeah.
That was great insight, Fernando. So, what, according to you, are the effective interventions to reduce stress in youth these days?
So, due to their concern and their misconception of reality, due to how social media and isolation may distort their perception of reality, I think the most important thing would be to introduce mindfulness to the youth and young adults, especially to get them into the present moment, to help them to go back to the breath, something as essential as just working on breathing, and to detach a little bit from their personal goals and ambitions, and which doesn't mean to let go, still to have discipline and to be able to do the responsibilities, but not just thinking, switching the focus from I'm doing this so I can become rich, and people may have a better perception of who I am, but I am doing this so I can help others. So the whole idea here is shifting the mindset from how can society help me to how can I help society. And it's been proven that the more we switch the focus from internal to external, the less isolated people are going to be, and the more the well-being levels are going to increase.
Thank you, Fernando, for the insight. It was really helpful. So, now I'm with Max.
How stress shapes young lives. There are like several outcomes. We're going to talk about them. First one is emotional outcome. Stigma around mental health fosters feelings of loneliness and social isolation, especially among those already struggling with depression symptoms. Studies indicate that social withdrawal and loneliness stem from a lack of understanding and support from family, peers, and the community. Secondly, behavioral outcomes. Poor peer relationships and social rejection are associated with higher level of social anxiety and avoidance, leading to disengagement from school. In extreme poverty contexts, youth experience stigma and shame, limiting their participation in school and community activities, which further exacerbates behavioral challenges, due to which a youth takes emotional toll. Parental monitoring and community support are protective factors that help reduce anxiety and depression among youth. And the behavioral impacts are stress disrupts social development, increasing antisocial behaviors like aggression, especially among youth exposed to unsafe environments. School disengagement is a common consequence of the stressors caused by social isolation and financial struggles. My second expert, Alicia, will give some opinion on barriers preventing youth from accessing support.
My name's Alessia. I'm going to be talking about some of the barriers preventing youth from accessing support and how they can overcome it. So, some reasons that may contribute to them not having the support they need. They might not have the available resources either in their schools or in their communities. There's the stigma around mental health, social pressures to assimilate, which may not be accessible due to economic circumstances or constraints, and lack of education when it comes to mental health. So some ways that we can prevent this is to provide affordable resources, make sure those resources are known, have supports within the community and within the schools that the students can easily access and know about, and provide the appropriate education in the schools that let them know about what is available to them, normalize mental health issues, and provide the support that they need. My
Building resilience together. So parents are the first step or the first persons a child looks up to. So parents can help their child very easily if they like promote open communication. Parental involvement plays a critical role in mitigating the adverse effects of stress. Open communication fosters trust, allowing children to share their concerns without fear of judgment. Parents can set routines, regular family activities, and structured routines create stability, which is particularly vital for children experiencing stress due to financial or social hardships. They can also actively engage and educate children about stress by spending quality time with children even during financially challenging times to reinforce emotional security. Use free or low cost resources like local libraries or community centers to teach stress management skills such as mindfulness. educate children about financial literacy, in simple terms, to reduce anxiety about family finances. The parents need to open up to their child and let the child open up to them. A great communication can help children a lot. Secondly, schools can help build resilience towards children, youth, by providing mental health support. Many schools have successfully implemented mental health programs such as in-house counseling services to address anxiety and stress in students. For example, mindfulness-based programs in schools across Finland have reduced depression rates and improved academic performance. Schools can also foster inclusion. Inclusive education programs that integrate diverse student backgrounds and abilities have been shown to reduce feelings of isolation while promoting peer support and understanding. Schools can also advocate for peer support programs, offer free lunch or snack programs to alleviate food insecurity and improve focus on food, provide scholarships for extracurricular activities to ensure inclusivity for students from low-income families. Also, develop peer support systems that don't rely on financial contributions like student debt mentorship programs to foster a sense of belonging and connection. So former students can come forward and lead the mentorship programs for the students in the school with a free of cost that can also foster a sense of belonging and also and the students will also be able to connect with the former students. Lastly, community. Community can help youth in a lot of ways by offering mentorship opportunities such as community-driven mentorship programs provide adolescents with role models who can guide them through personal and academic challenges, create safe spaces, establish youth centers and recreational facilities, offers secure environments for social interaction and stress relief. Also provide financial support by providing micro grants for low-income families or subsidized after-school programs that help alleviate economic pressures. These programs, as highlighted in the Finnish economic stress model, are particularly effective in bolstering resilience among vulnerable youths, support local initiatives, and lobby for policy changes. Communities can establish financial aids or subsidies for youth programs such as sports teams, art classes, or tutoring, making them accessible to all families. So the families don't have to pay anything from their pocket because they don't have that much to put extra for like such as sports and art classes. So communities can come forward and help them in this way. Also advocate for increased government funding in housing, mental health, and educational programs targeting underprivileged families. Communities can come forward and ask government to ask for funding for like mental health programs, educational programs that can help underprivileged families a lot. Let's hear what our expert Justin has to say about the situation.
Okay, so the question is, how can schools better address the mental health needs of students from low income families? And I think to better help students from low income families with their mental health, schools can offer more mental health help by having counselors available and working with local groups that can help. We can train teachers and staff to spot signs of mental health problems so that they know how to help. We can teach social, emotional skills so students can learn how to manage their feelings and cope with stress. We can create a safe and supportive school environment where everyone feels included and can share their emotions without fear of judgment. We can involve families by providing resources and support for parents to help their kids, providing extra support like food, housing, and after-school programs to ease some of the stress outside of school. We can encourage friendships and peer support so students can help each other when they're feeling down. We can help teachers build strong relationships with students so they feel cared for and understood. Being flexible and reducing stigma by letting students take mental health days and making it okay for them to ask for help. I know a lot of these ideas are easier said than done, but those are some ideas of how we can help students from low income families with their mental health. And another thing is, I'm sure some schools are doing a great job of this already. Um, and I think if they focus on those things, it would be greatly beneficial. Okay, thanks.
So these were like insights from my experts and my research on this topic. I hope it was helpful and thank you.